Hello, my name is Paul Garner. I work at the Liverpool School of Tropical Medicine. I'm an extraordinary professor appointment here in Stellenbosch University, and I gave a talk on the 26th of January 2017, the first in their series for the Global Health Seminar series, and this is a version of the talk that I gave. And during the talk I spoke about systematic reviews. What have they ever done for global health? This comes from Monty Python's What Have the Romans Ever Done for Us? And so what I thought I'd do in this talk, and I wanted to point out that actually this is based on work done with Stellenbosch and with Jimmy Volmink and colleagues over the last 20 years. Here's Jimmy giving the Leverhulme talk at the School of Tropical Medicine about 18 months ago, a very prestigious talk. We were very honoured to have him with us, and our Deputy Director giving Jimmy the Leverhulme Medal for all his work over the years, and also in particular he noted that Jimmy needed a medal to have been able to work with me for that length of time. So, and we always like these Leverhulme lectures because there's a bit of a party afterwards, and here are some colleagues that work in systematic reviews in Liverpool. So what I wanted to do in the first part is just talk about a little bit of a background to systematic reviews in Cochrane. Then I want to have a look at what Cochrane and the systematic review movement really has done in global health, and at the end I will reflect on how this affected me in my work in my institution, and reflect on how a unit such as you've got here in Stellenbosch may interact in your new department as you go forward. So how long does it take to do a systematic review? A systematic review cannot be done in an afternoon. It is a piece of work that can take between 6 months and several years. It is a primary piece of research that needs you to use scientific methods. And the differences between a systematic review and a narrative review are outlined on this slide. A systematic review will usually ask a specific question, whereas narrative commentaries will often be very vague. A systematic review will generally have a protocol nowadays. For Cochrane there is always a protocol, and it is an important part of systematic reviews to predefine what your question is and what your inclusion criteria. Systematic reviews include methodologists, and they are highly respected on the panel, whereas narrative reviews are often dominated by specialists and their opinions. As I've said already, a systematic review will explicitly state the types of study it will include, the types of participants in those studies, and the types of outcomes that are measured. The search will be absolutely clear. Studies will be examined for risk of bias and systematically reported. And probably this one is the most important, is that the results of the study are the review takes into account risks of bias, precision, size of the effect in interpreting the evidence, rather than simply looking at statistical significance and not taking into account the quality of the review. This is the quality of the primary study. So it's very important to remember systematic reviews are a critical appraisal, and the bottom line of the review is tempered by the quality of the included studies. Cochrane is a bit of an unusual beast really, and really the Cochrane collaboration was a very important vehicle for really establishing the principle of systematic reviews and ensuring their that they were done and done well, and developing the methods. So it is an unusual organisation because it talks about collaboration and not competition. It avoids duplication of effort and builds on what people are interested in their enthusiasm. It was the first and probably one of the few journals that updates their publications, so that it says that any review is useless if it doesn't any review can immediately become out of date as new studies are published. So these reviews try and stay up to date, minimizing bias, and being published electronically. This was very unusual when Cochrane was set up. And the publishing electronically also helped with the updating process. And it was set up in 1988. Ian Chalmers was described as leader of an obstetrical Baader-Meinhof gang, which was extremely attractive to me as a young doctor coming into research. And so that's what we're going to go through today. Cochrane set up these methods and these teams, set up this global organisation. What has this done for global health? What happened in my institution? And what are the messages for you in a new department? So, Cochrane have mainstreamed systematic reviews. It's absolutely extraordinary. It's gone from the stage when I teach on a course in Liverpool in 1994. I taught about the human albumin review that suggested human albumin in shock probably was of little benefit and may even do harm. Doctors on the course, young doctors, said that this was misguided nonsense, that systematic reviews were a threat to their clinical freedom. That was then. In 2004, I was talking with students about it, and they were listening a little bit more, and one diploma student explained to me that they had been asked about a Cochrane review in their higher membership clinical examination. Jump to 2014, the course that year organised a great LSTM bake-off, and during the bake-off, here they are making biscuits with the Cochrane logo on. So totally internalised these approaches. Fantastic. There they are. So Cochrane, so that's one thing. It's mainstream the approaches. It's produced a huge resource of reviews. Thousands, I don't know, I'm not very good with numbers, but there's over total Cochrane reviews produced to date, something like 6,000. Fantastic progress. So Cochrane reviews have not only produced a huge resource of systematic reviews, but they have provided a vehicle for translating research into policy and practice. So what was happening when I was started it off in this area is all the donors and all the organisations and everyone involved in research wanted to see it translated into policy and practice, but people didn't know how to do it, and they were taking single studies and trying to say, we've done this vitamin A study in Ghana, how do we get that into policy and practice? And systematic reviews really helped generate and support this idea of generalizing the evidence and particularizing the decision. So you get a bottom line out of all of the reliable evidence around a question, a global summary. For example, the impregnated mosquito nets for malaria, a Cochrane review done by Christian Lengler, included 22 trials. Over 80 were excluded because they were of insufficient quality to provide reliable results. And it had a very clear bottom line from the meta-analysis in terms of child mortality, with 5.5 children lives saved per year. An important intervention, an important effect. So reviews provided this base summarising evidence around effects, but people then knew that they had to do with something with reviews, but didn't know quite what to do. And so it helped stimulate transparent policy development as a result of this, where in the past policy development came out of GOBSAC, a group of old boys sat around a table, who came up with an opinion about what they thought the evidence showed. And the systematic review approach then put in an infrastructure around that you use. The panel decides on certain PICO questions, the evidence is summarized, grade is used to summarize the evidence, and then the panel meet to look at the outcomes and decide and formulate recommendations. A very clear splitting between the evidence and the decision, which is very important. So in malaria this has happened. Here is a typical grade table used in a guideline group which summarizes all the evidence. This is around a drug used for malaria, pyronidine, and this summarizes all the adverse effects showing considerable problems with this drug, and the panel considered this, debated the desirable and the undesirable effects, and then made a judgment and a recommendation. And this is an evidence to decision making table that is also published along the guidelines to make things absolutely transparent. So Cochrane reviews have also had, particularly Cochrane actually, because of its focus on enthusiasm and on bringing younger people in their careers, it's helped build capacity in good science, epidemiology and stats in young people, particularly in medics. Here is an event at your own institution, or I would think almost all of these people have completed a Cochrane review published in as primary research in a journal with an impact factor of 6 or more. Again, of course, in Cornell, young people completing reviews here, and recently a workshop in Ghana. This is actually a slightly different workshop where we're actually nowadays training people to read reviews, because there are so many out there. In the past there were no reviews, so we were persuading people to do the reviews. Now much more we are talking about helping people read the reviews. That's what you have to help people do. And here's some advanced training in authorship and editorship run in your institution here last year. Cochrane systematic reviews have also helped uncover poor scientific practice. This is relevant here with these 3 people associated with Stellenbosch University looked at a systematic review of animal studies. This in a vaccine, MVA-85A, a TB vaccine. This arose because we were embarking on a review of studies in humans, and we picked up on some issues with the animal studies. Interestingly, when we did the review, there was one additional study that we had not found by ordinary by actually quite sensitive searching. It was not indexed in a way that you could find. We only found out it through contact with key informants. So of these studies in animals, there was very little reporting of competing interests. In other words, whether people conducting the animal studies had IP in the vaccine. Overall they were right, and this is not unusual for animal studies at all. But what was interesting was that the trial that we found from the key informant actually was published after the efficacy trial had started in children in your country. And the trial that had not been published when the trial started here, in fact 5 out of the 6 monkeys in the new vaccine group had to be euthanized because they became so severely unwell. They died as a result of becoming unwell, and in the control group only 2 out of the 6 died, and there was a clear delay with this publication of this review, and the publication of the review was well after the monkey experiment was terminated. So you can certainly see that there is an issue around transparency here and potential delay with publication of a trial that would have not been very encouraging perhaps to people to proceed to human studies. So Cochrane's systematic reviews have helped identify priorities in research. You can't get any money if you put a grant application in for a trial in the UK. You need to have a systematic review in the background to it, or refer to a systematic review. Systematic reviews can help identify priorities. This is quite an interesting one where of topical umbilical cord care, review completed in 2004, lots of silly trials of different powders in hospitals and so forth, but nothing about umbilical cord sepsis in community births where perinatal mortality is extremely high, and the reviewers concluded that trials were needed in these areas. And indeed, another Cochrane review some 11 years later show these trials have been done with a 19% reduction in neonatal mortality, quite a substantive effect, very important. So the review, I think, helped contribute to this, people exploring and finding out community cord care is highly effective. So Cochrane reviews sometimes have challenged the status quo, and obviously I'm using many examples from my own area of expertise and reviews I've been involved in because I know about them. The deworming review continues 12 years after the first edition, or actually even more than that, more like 15 years after the first edition, to continue to create controversy. 44 trials, 67,000 participants, with another trial, the biggest trial ever done, 1 million children. The authors of the review concluded it is probably misleading to justify programs in Africa based on evidence. The debates when this review came up was accusations it was misleading and incomplete. The establishment really became very heated, described the Cochrane group as systematic reviewers of RCT Talibans, fundamentalists with their rocket-propelled systematic review grenades on their shoulders, and apparently nothing better to do. So this is debate for sure, and the debate on deworming will continue. I think there's a lot of vested interests in seeing this very simple intervention be effective. Obviously, if you deworm children, you get rid of their worms, but the claims of improved economic productivity in whole countries are almost certainly over-egged. Cochrane systematic reviews have helped develop methods. DTA reviews, diagnostic test accuracy reviews, some done by centres in Cape Town, been very important. These were complicated methods to establish, and methods in other areas are always being developed, and Cochrane remains at the forefront of methods development. So in summary, there we go. Cochrane systematic reviews Cochrane has helped mainstream systematic reviews, has generated a huge resource, has helped provide a vehicle to translate research into policy. It's helped build capacity in good science. It helped identify priorities in research, and it's challenged the status quo and does and continue to develop methods. So here's these methods can be applied to a variety of different forms of evidence. Here's some examples, examining evidence around investment in healthcare in areas of conflict, whether that helps stabilization. Systematic reviews, looking at systematic reviews for bioterrorism, for surveillance systems. Many different reviews in many different areas. So whilst we can show that Cochrane has demonstrated impact on methods, did it actually strengthen my institution, Liverpool School of Tropical Medicine? How did it impact on other academics? Well, sometimes some good people join review teams and help get reviews done. This is a review where somebody helped get a review done, and we were very pleased David could join the team. Sometimes people doing a piece of work will come to us and ask us to help them with the methods for a systematic review and publish it elsewhere other than in the Cochrane Library, and that's fine as well. And this is an important review that was in JAMA. Sometimes people come for advice because they've got bogged, and this was a review about equity and community health services. We simply tried to steer them along the right track, although I'm not convinced that this review has all the features I would include in a high quality review, but at least people are moving in the right direction. Students, master's students, Chico is a very smart person and worked on this review with Peter McPherson, examining diagnostic accuracy in clinical staging about when to start people on ART. Nice piece of work. You can do this one. Woman wanted to look at antiretroviral drugs in breast milk. So when Catriona came to us, she had a competent and a good review done, but it wasn't systematic, and she wanted me to help her retrofit systematic review methods on what she had done, because she hadn't written a protocol in order to do this. She sort of set out in a more narrative kind of way, and of course that was problematic, and at the end of the day we ended up having really to more or less redo the review, but she accepted that, and a very good product was produced. And sometimes your own directors come to you. So Janet Hemingway asked us to help with this, using looking at mosquito nets and looking at entomological outcomes rather than human outcomes, and this helped stimulate further research on methods. So we were very excited about this. So here you are in Stellenbosch. You've got a great collaboration. You're already collaborating worldwide. Here's Anka working with Mawaka on a review from Tanzania. I think this gentleman in the middle is probably I think he's a sleeping author. I'm not sure whether his inputs would justify authorship, to be honest with you. But you've got a great active team. So how does that fit into your new Centre for Global Health? I'm not sure. It's something you need to talk about, but I would recommend to the Centre for Evidence-Based Healthcare, build your methods, build your expertise, build your people, keep a focus, don't get pulled in every direction, articulate with your colleagues about how you work and what you can offer and what you can't offer, and don't feel, it would be great if people work together, you drawing on your methods, but sometimes people want to do their own thing. It doesn't matter if people stay in silos. Don't get upset if that happens. And people from other departments, I would say to you, if you are interested in systematic reviews, come early, have a good question. Don't expect a blueprint approach. It takes time to work out these methods. Collaborative research, that's what this is about. It's not applying a formula, and don't rush it. Thank you for inviting me. Delighted to be here, and thanks so much.